For decades, type 2 diabetes has been widely regarded as a permanent, progressive disease and unavoidable chronic condition that must be managed for the rest of one's life. Most patients are told that they'll need to rely on medications indefinitely and over time, possibly even insulin injections. However, a growing body of scientific research and real-world clinical success stories are turning that belief on its head. In fact, recent studies are revealing a compelling new truth. Type 2 diabetes can be reversed in many cases, especially when the underlying causes are properly addressed. And at the forefront of this shift in perspective is a remarkably simple, cost-free lifestyle strategy: intermittent fasting. This article will explore how intermittent fasting works to combat the root causes of type 2 diabetes, the science behind it, how to safely implement it, and why it holds so much promise for millions of Americans looking to regain control of their health. Understanding the true culprit, insulin resistance. The traditional focus of type 2 diabetes treatment has largely been on managing high blood sugar. While elevated glucose is certainly a defining feature of the disease, it is not the core issue. To understand how to truly reverse the condition, we need to take a closer look at insulin resistance. Insulin is a hormone produced by the pancreas that allows your body to absorb glucose from the bloodstream into cells for energy. In people with type 2 diabetes, cells become increasingly resistant to insulin signals, forcing the pancreas to produce more insulin in response. Over time, this leads to chronically elevated insulin levels, a condition known as hyperinsulinemia. This persistent insulin overload places enormous stress on the pancreas and other organs. It also contributes to fat accumulation, particularly in the liver and around abdominal organs, which worsens insulin resistance even further. Eventually, this vicious cycle leads to dangerously high blood sugar levels as the body can no longer compensate. So rather than a lack of insulin, the real driver of type 2 diabetes is insulin resistance caused by prolonged exposure to high insulin levels. This means that the true path to healing lies in lowering those insulin levels, and this is exactly where intermittent fasting comes in. What is intermittent fasting? Intermittent fasting is not a diet in the conventional sense. It's a pattern of eating that alternates between periods of eating and periods of fasting. Not eating. During the fasting periods, your body is allowed to rest from digestion and insulin production. This creates a hormonal environment that promotes fat burning, improves metabolic health, and enhances insulin sensitivity. There are several different approaches to intermittent fasting, including the 16/8 method, fasting for 16 hours each day and eating during an 8-hour window. The 5-2 diet, eating normally for 5 days a week and significantly reducing calorie intake, around 500 to 600 calories onto non-consecutive days. Alternate day fasting ADF, fasting every other day or eating very few calories on fasting days, 1 meal a day OMAD, eating 1 large meal during a 1 to 2 hour window, and fasting the rest of the day. While all these methods vary in structure, they share the same core goal: reducing insulin levels by extending the time between meals. How intermittent fasting reverses insulin resistance: when you eat, especially meals rich in carbohydrates or sugar, your blood sugar rises and your pancreas releases insulin. But when you fast, your insulin levels naturally decline because there's no food stimulating its release. This break allows the body to gradually reset its insulin sensitivity, meaning your cells become more responsive to insulin again. During fasting periods, your body also switches from burning glucose sugar for fuel to burning stored fat. This process is known as fat oxidation, and it is essential for reducing visceral fat, the dangerous fat stored around your organs. Visceral fat plays a significant role in promoting insulin resistance, especially in the liver and pancreas. Furthermore, fasting helps defat the liver, a critical step in reversing insulin resistance. Studies have shown that reducing liver fat significantly improves blood sugar regulation, and intermittent fasting is a powerful way to achieve this without resorting to medications or surgery. Beyond blood sugar, the many benefits of intermittent fasting. Positive effects of intermittent fasting are not limited to blood sugar control or insulin management. When you engage in regular fasting, Your body activates several key biological processes that support overall health and longevity. 1. Autophagy. The body's cellular cleanup process. Autophagy is a natural, built-in process that occurs during fasting. It allows your body to break down and recycle damaged cells, proteins, and other cellular debris. Think of it as your body's internal housekeeping. Autophagy helps reduce inflammation, lower the risk of chronic disease, and may even help prevent cancer and neurodegenerative conditions like Alzheimer's too. Boosting human growth hormone HGH. Fasting triggers an increase in human growth hormone, a key hormone involved in preserving lean muscle mass and promoting fat metabolism. HGH also supports healthy skin, strong bones, and recovery from injury. This is especially important for older adults who naturally experience a decline in HGH with age. 3. Reduced inflammation and oxidative stress. Chronic inflammation is a hidden contributor. Too many diseases, including diabetes, heart disease, and arthritis. Intermittent fasting has been shown to lower inflammatory markers and reduce oxidative stress, helping protect the body from long-term damage. 4. Improved heart health. Fasting can lead to improvements in several risk factors for heart disease, including lower triglycerides, reduced LDL cholesterol, improved blood pressure, and enhanced vascular function. 5. Weight loss without muscle loss. Unlike many calorie-restricted diets that can lead to muscle breakdown, intermittent fasting allows your body to preserve lean muscle while burning fat. This is crucial for maintaining metabolic health, strength, and physical function as you age. Scientific evidence that supports diabetes reversal. While personal success stories are inspiring, science demands data. Fortunately, the evidence is growing fast. One of the most notable studies in recent years was published in the journal Cell Metabolism in 2023. The study followed a group of individuals with type 2 diabetes who implemented an intermittent fasting regimen over several months. The results were astounding. 47.2% of participants achieved full remission from type 2 diabetes. Many were able to discontinue diabetes medications, including insulin. Significant improvements were seen in insulin sensitivity, liver fat, body weight, and overall metabolic health. This study was not an isolated case. Several other clinical trials have echoed these findings, showing that intermittent fasting is not just a fad, it is a legitimate therapeutic approach that can restore normal blood sugar levels and halt the progression of the disease. If it works, why isn't everyone doing it? Despite its proven benefits, intermittent fasting is still not widely recommended by many doctors. Here's why. 1. The fasting stigma. For many people, the word fasting conjures up images of starvation, weakness, or religious rituals. There's a common fear that fasting is unsafe or unnatural. In reality, humans evolved with natural fasting periods. Our ancestors didn't eat 3 meals a day with snacks in between. 2. Lack of education. Many healthcare providers receive limited training in nutrition or metabolic therapies during medical school. As a result, they may not be fully informed about the benefits and safety of intermittent fasting, especially when supervised properly. 3. Symptom management versus root cause treatment. Modern medicine tends to prioritize managing symptoms through medication rather than addressing root causes. While drugs can lower blood sugar, they don't fix insulin resistance. Fasting, on the other hand, targets the root problem, but it doesn't generate profit for the pharmaceutical industry. 4. No profit motive. Intermittent fasting is free. It requires no special products, no prescriptions, and no procedures. In a healthcare system driven by financial incentives, cost-free interventions often receive less attention.